Mr. Bryan. My name is Cynthia. I'm the nurse that's going to be with you today. Can you just please tell me your full name and your date of birth?
Brian Leon, April 19, 1990.
All right, thank you. And we're just going to go over the abdominal assessment. Okay, so we're just going to go over some few things. But the first thing I need to do with you is just gather some information. So I'm going to ask you a couple set of questions, and you just answer back to me. How's your appetite?
Good.
Is it normal? Do you eat regularly?
Yes, regular.
Breakfast, lunch,
Yes,
dinner? No complication? No difficulty swallowing?
No.
No difficulty chewing?
No.
Okay. No heartburn?
No.
Indigestion, stomach pain?
No.
Stomach cramps?
No.
Abdominal pain?
No.
Okay, good. Any changes in taste?
No.
In thirst?
No.
No nausea and vomiting?
No.
Okay, good. And bowel movements, are they regular?
Normal.
They're normal? Did you go today?
Yes, ma'am.
Good. Okay, any constipation?
No.
No problems? Okay. Have you had any abdominal surgery in the past?
No.
No, good. Do you smoke?
No.
Do you consume alcohol?
Occasionally.
Okay, and how many drinks, let's say, per day would you say you drink?
1 or 2.
1 or 2, okay. Good. All right. And have you been outside the country recently?
No.
No. Okay, perfect. All right, so we're going to start with your abdominal assessment. So I'm just going to lift up your shirt, just exposing your stomach, okay?
Sure.
And forgive me, my hands are cold. All right, so we're just going to expose your stomach. All right, and the first thing we want to do when we're inspecting, because the first thing with an abdominal inspection assessment is we first inspect. So we just want to look at the contour. We want to see if there's any scars, any bulges, any hernias. Obviously there's nothing going on, so we just want to make sure and just look. Again, we just want to ensure that there's no lesions. The contour, you want to make sure it's symmetrical, and again, no bulges. You want to see that your breathing is normal and even, and we want to look for the motion of any peristalsis that's going on, and which nothing is happening, which is good. Okay. The second part of the examination we want to review is we want to auscultate. Okay. Usually we leave auscultation for last, but since this is the second step, because we need to listen before we go in and touch anything.
Okay.
Because if we touch anything, then that's going to alter whatever I'm going to listen to. So we need to ensure that we listen to now. Okay, so the next step we're going to do is we're going to auscultate. What we do here is we actually divide your abdomen into 4 separate regions. So it becomes your right lower quadrant, your right upper quadrant, your left upper quadrant, and your left lower quadrant. Okay? And I'm just going to take a listen, and what we want to hear, what I want to hear is, is your bowels active, either hyperactive, or either hypotonic, which means they're not really active. So hyperactive is we hear a lot of clicks or gurgles, those sounds that we hear, sometimes they're loud enough that they actually people could hear them. So I'm just going to take a listen through your quadrants, all right? And again, we just want to hear again the gurglings and clicks that I heard just right now, auscultating. Okay, and which is good. And then again, we want to hear 5 to 35 per minute. That means it's active. Okay. Now we're going to use, I'm going to auscultate your liver and spleen. Okay. And want to make sure if I could detect any high pitch friction rubs. All right. So we're going to do your liver first. Okay, good. So after listening to your liver and spleen, we're going to listen for your aortic, iliac, and renal arteries. So we want to listen to your aortic artery. So we're going to just take a listen. And with that, we use the valve portion of our stethoscope. I'm always going to move to the side because those branch off. Okay, good. So after auscultating, next thing we want to do is actually percuss. So we're going to percuss in your quadrants, and we want to listen to dullness and tympany. Again, we hear dullness over the organs and solid masses, so when we're palpating your liver, we're going to hear a dullness sound because it's mass. Tympany, again, will be over the stomach and the intestines because they should be filled with air. Okay? So we start from the midclavicular line, and I'm going to start going down and start percussing. Let me just grab some tape because we're going to measure the border of your liver. So I'm going to start from the bottom up and then the top down, all right? Move this tape here. Just have to expose this area a little bit because I need to. Okay. I'm just going to have measuring tape. Okay, so it could be anywhere from 4 to 7 centimeters, and yours is 5. So we're just measuring. Right, I'm just going to take these off. Okay. And after we're done doing the border, we want to percuss the spleen. So that's what we're going to do next on here. So again, we're going to do the same thing. I'm going to go mid-clavicular line. I'm going to go from the bottom up and then back from the top down. I'm just going to grab some tape. And the spleen is a little bit harder since it's underneath kind of your stomach. So. So we're just having the borders of your spleen, so it's good. These off. Okay. So now we're going to start with palpation. We're going to do just a little bit of light palpation first, and then I'm going to actually go in a little bit deeper to just assess. Okay. So. All right. Let me just check these off. Okay, so we're going to just do light palpation like you said. Okay. So instead of hovering. first thing we're going to do is then start going around your quadrants, all right? Tell me if you've experienced any pain or discomfort. No pain?
No.
Okay. So here we're just feeling, and we want to make sure that you have, obviously in the beginning we were just looking and inspecting to see if there was any bulges, but now actually feeling, we want to make sure there's no like masses. Okay. No pain, right?
Nope.
Okay. Alright, so now I'm just going to go in a little bit deeper. I need you to just, when I tell you, just take a deep breath from me, okay? I'll let you know. Okay. Can you take a deep breath and just hold it for me? Alright. Can you exhale? Good. Can you take another deep breath for me? And hold it. Good. Okay, good. Okay? And so just a deep palpation, and that would be it. Any questions?
No.
Okay. All right, and now I'm just going to have you just sit up, and I'm going to palpate and percuss your kidneys.
Okay.
So if you just have a seat on the edge of the bed, you face kind of this way. I'm just going to lift up your shirt here, okay? And let me know if there's any pain or discomfort. Any pain?
No.
Alright. And that is all for the exam. Do you have any questions?
No.
Alright, thank you.